Our next speaker would be Dr. Haimanti Chaudhary.
Good afternoon, judges. My free paper is Novel Artificial Intelligence Derived Dry Eye Analyzer in Evaluation of Dry Eye in Vernal Keratoconjunctivitis. I do not have any financial interest in this presentation. Vernal keratoconjunctivitis is a sight-threatening illness in children which also has often underdiagnosed dry eye, and because doing dry eye tests in pediatric patients becomes a problem, so it remains undiagnosed. Deuce 2 has defined dry eye as a multifactorial ocular surface disease which is characterized by tear film instability and hyperosmolarity. These two have a synergistic effect which causes ocular surface hemostasis is disturbed, and this is particularly very relevant in children who gives rise to loss of epithelium because they have a chronic ocular inflammation secondary to vernal keratoconjunctivitis. With this background in mind, our aim was to explore the role of novel AI-derived dry eye analyzer in the evaluation of dry eye in children with VKC compared to normal children. The methodology involved ethical committee approval was taken, informed consent was taken from the guardian of the patient, and then we embarked upon a prospective case-controlled study. In a 6-month period, study participants were children with VKC, and those with refractive error served as controls. The examination protocol was first they were done slit lamp examination, and then dry eye analyzer was done, and after that the traditional Schirmer test and ocular staining were also done. So what does the dry eye analyzer does? It measures the non-invasive breakup time, the tear meniscus height, infrared mammography, and lipid layer interferometry. In non-invasive breakup time, Placido's disc-based white light is diffused into the cornea and we look for image distortion. In tear meniscus height, it is measured with an inbuilt ruler in line with the pupillary center, and if it is more than 0.2, it is normal, and we can also measure the tear meniscus volume. Infrared mammography is based on the principle of healthy mabum autofluorescence. When an infrared light falls upon it, and then the AI image is superimposed on it, and the first image that you see here is a normal mammography report. The second video is a grade 2 MGD, and the third video is a grade 3 MGD. Lipid layer thickness is based on the principle of interferometry. When colorful light falls on a lipid layer, when there are more interferometric fringes, it says that it is a thicker layer. Our results show that the commonest VKC was the mixed type. Schirmer grading was, however, only positive in 40% patient, whereas overall dry eye in VKC patients were 54.8%. When we compare all the other study parameters, you will note that non-invasive breakup time was positive in VKC patients 41% versus 24% in controls. Lipid layer thickness was abnormal in VKC 65% of them, and in control it was 46%. Mammography scores were 57% abnormal in VKC versus 38% in control. So what we already know is that there is a prevalence of allergic conjunctivitis and dry eye. In our case, it was 54.8%. What our study adds is 2/3 of kids of VKC have abnormal lipid layer thickness. More than half of VKC kids have meibomian gland disease, and Schirmer score can be very misleading in VKC kids because of reflex hyperlacrimation. There are certain limitations of our study, that is the small sample size, and use of digital device history was not taken into consideration. So what are the translational potential of our study? This is how the report of the dry eye analyzer looks like, and you can see it is a color-coded report. When it is the first report is showing dry eye in the right eye and the left eye is showing a warning. The second report is showing healthy in both the eyes, and then again the third report is a warning in both the eyes. So when we get a color-coded report like this, it helps to identify the type of dry eye. By doing this, we can get image-based targeted therapy can be done, and we know precisely which layer is to be treated. Thank you very much for your kind attention.